Okay, so in a moment, I'm gonna get my assistant to lie down in the prone position, face down in the face paper. But let me demonstrate this actual table. This is a specialized drop table that we use in chiropractic for many different types of adjustments, drop table adjustments. But in this particular case, we're gonna use it as a mirror image correction adjustment for a cervical kyphosis. So this mechanism here pops up, and then when I adjust the spine, it drops below. And I can actually move this in different directions if I needed to. I could elevate it if I needed to go higher or lower. And I can also change the angulation like that. So for him, we're gonna change the angulation for cervical kyphosis to induce some actual extension. So go ahead and lie down over here. So the patient will be lying down. Good, slide up a little higher. Good, come up over here. So I'm gonna get that neck into an extension position, okay? Awesome. I'm gonna prop up the top piece. Okay, it's very gentle for the patient, okay? Really, really gentle. I get my contact. So right inside there, and adjust, just like that. Very easy. I can do 1, 2, or 3 adjustments. Get my contact. I can also get a contact like this. Very gentle, very effective, okay? So let me show you what we're doing with a spine. So here's a spine model, okay? So remember, the cervical spine is kyphotic like that, right? Okay? So we're basically applying an adjustment into the spine like that to get it to bend in this position here, okay? Sit up for a moment. Okay, so there is patience in there. The spine is kyphotic. Okay. And we're basically getting it into a extension position and adjusting into the curve. Okay. So I'll show you here. So it's kyphotic over here. We're gonna get into an extension position and we're just into the curve. Get that spine to curve back like that. Retrain those tissues to bend the spine back into that lordosis position. So that's a drop table technique that shows a corrective adjustment in the mirror image position for cervical kyphosis. Let me show you how we do this now with an instrument assisted adjustment. So one of the adjustment tools that we use in our office is called an impulse adjusting instrument. We also use an arthrostim adjusting instrument. In this case, I'll just show you this one. And there's a stylus here. There's a double prong stylus. I also have a single prong stylus, but I'll demonstrate the double prong. And there's 3 settings. Level 1, taps. Level 2 is a little stronger. And level 3, the next level of intensity of load, okay? So level 1 is what we use for the cervical spine. Again, everything we're doing is to induce that cervical lordosis, help to reverse that cervical kyphosis, okay? So on a cervical spine, hold that for a moment. So, hold the bottom good, okay? So, good. So there's cervical kyphosis. I'm gonna get the neck into extension and tap, 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 tap. Just like that, okay? So that's what we're gonna do. Okay, so turn over, turn face that way, back up a bit. That's fine, perfect, yes. Sit up nice and straight. So let's pretend that there's a cervical kyphosis. There's a reversal in there, right? I set up the patient, so jut your chin forward. Good, look up to the ceiling. Come back, get a nice lordosis curve in there, and tap, tap, tap. Okay? And that's a mirror image adjustment for the cervical kyphosis. How did that feel?
Good.
Very easy and very useful for patients with cervical kyphosis. Next thing I want to show you is the traction setup. We're going to show you the home version first over here, and then we'll take you into our rehab room right across the hall, right there behind the camera, and I'll show you the actual cervical extension traction that we do in office. If you enjoyed that segment and now you want to see the corrective care traction techniques for home and in office, go here right now to watch that, and you can see now the corrective care traction techniques for cervical kyphosis.